Botulinum toxin. If we look at botulinum toxin, this is a toxin made by a bacteria called Clostridium botulinum. Right? Clostridium botulinum. Now, this is an anaerobic bacteria, and it tends to grow especially in these canned foods or anaerobic environments. Like when you go to a supermarket and you see something that's like a canned item, or even those juice packets which are heavily puffed up, they could be full of juice or milkshake or anything that's canned for that matter, especially if it doesn't have too much of salt or vinegar or acidic substances that have an antimicrobial activity. So things with less sugar, salt and vinegar, and it's anaerobic, these bacteria, if they contaminate during the production of these food items, it can actually grow in the cans, and it can produce a toxin called botulinum toxin. So there are different kinds of botulinum toxin, like botulinum A, B, C, D, E, F, G, and we'll talk about what they do soon. I want you to understand that these botulinum toxins, they inhibit neurotransmitter release. And these enzymes, they're what we call zinc endopeptidases. These toxins are enzymes called zinc endopeptidases. So they damage or they cleave the V snare and the T snare protein. So if there's no V snare, T snare protein that's functioning, you cannot do proper exocytosis of the acetylcholine molecules or the neurotransmitter molecule, whatever it is. Now, there are different botulinum toxins. A and E will attack SNAP25, and then you have botulinum toxin type C. This will inhibit your syntaxin and SNAP25. Also, BDFG will attack the synaptobrevin. Okay, and because you are unable to release neurotransmitter, you will get a flaccid paralysis. This is where your muscles are totally lax and soft and relaxed over there. So this happens usually within 9 hours to 9 days after consuming something that is a contaminated canned food item. So don't eat old food items, past their expiry date, and especially if those canned food items don't have the proper shape of a canned item. Instead, they look all puffed up, like there's gas building up in it. It doesn't mean you're getting more stuff. I think it means that there might be some Clostridium botulinum just growing and they're releasing some gases, and that is dangerous for your health. Because what happens is you start to get this paralysis, and it goes from up to down. Up to down meaning you lose your ability to speak, so that's up in the head, and you are unable to swallow so well, and even your eyes, you get double vision because of paralysis of the muscles that control your eyes, your extraocular muscles. Eventually your eyelids will also droop, and you can't keep your head up also, so your head kind of falls forward every time, and you start dropping a lot of things from your hands, and eventually you get respiratory failure, and this can end your life. There are no sensory signs over here. There is another bacteria for which you should, before we go on, let's just talk about some uses of botulinum toxin. So we can use botulinum toxin in controlled amounts to inhibit, to sort of paralyze some muscles in the body. For example, if somebody has wrinkles on their forehead, so these actors, actresses, and even people who can afford it, they will actually go for Botox injections. And Botox injections are where they inject small amounts of botulinum toxin in areas like the forehead and around the eyes, and that will cause paralysis of the muscles and make less wrinkles. Reduce the wrinkles on the face. This can also be given in places like the esophagus for conditions like achalasia, cardia. This achalasia cardia is a condition where your lower esophageal sphincter is spasmed. It doesn't relax, it's always tight. So food cannot go beyond your esophagus into the stomach so easily, especially solid foods. And there are different reasons for how people get achalasia cardia. One example is you get this infection by a parasite like Trypanosoma cruzi. So Trypanosoma cruzi, T. cruzi. And this damages the nerves in your esophagus, and it doesn't allow the relaxation of these muscles. So there's this increased tone in the lower esophageal sphincter. So one of the treatments what we have for this is we give you a little Botox injection in your esophagus. So this relaxes the lower esophageal sphincter at least for 3 months, and you'll be able to eat better. And then after 3 months again you may have to undergo the same injection process again. We can give botulinum injections also in conditions like blepharospasm. So blepharospasm is where your eyelids are really tightly sealed shut. Maybe there's some foreign body in your eye, and by reflex you can't open the eye, or there's a bad infection in your eye. So one of the treatments is we can give botulinum toxin to paralyze the eyelids so they relax and you can open the eye and inspect what's going on over there. Also in conditions where you have too much of sweat in the eyes, like in the hands, like hyperhidrosis. Hyperhidrosis means you have sweaty palms, too much of sweat, and you tried using talcum powder and all those other creams that you get in the market and it didn't do such a good job. You can give botulinum injections in the palms, and remember that botulinum inhibits V-snare T-snare interaction. So you cannot release acetylcholine, which is a neurotransmitter that is also used by the autonomic nerves. So the sympathetic nerves in our palms and on our skin, they actually release acetylcholine, unlike in the rest of the body where they release norepinephrine. But by giving these botulinum injections in the palms, you will actually inhibit the release of the neurotransmitter that causes sweating to take place, that goes to your sweat glands and causes you to sweat that watery sweat over there, the eccrine sweat glands. We call them eccrine sweat glands, ECCRINE, eccrine sweat glands. Next topic is tetanus. So what is tetanus? Again, this is caused by Clostridium tetani. It's sort of related to the Clostridium botulinum bacteria, at least in looks. And so what it does is here you again have an anaerobic bacteria which tends to infect wounds, open wounds, especially from rusted metal. If you get scratched by rusted metal nails or rusted metal, any object which is made of rusted metal, because these Clostridium tetani bacteria, they love the iron, especially the rust. So it's even present in the mud and sand. So if you cut yourself and you fall down, if you get an abrasion, you can also get tetanus infecting into your skin, and this makes its way into your nervous system, and it releases a toxin that destroys synaptobrevin. Now this again inhibits the release of neurotransmitters. So the synaptobrevin gets destroyed by the tetanus toxin. Now this tetanus toxin, if you damage synaptobrevin, you cannot release neurotransmitter, and in this case it will be inhibitory neurotransmitter in your central nervous system in the spinal cord level. So when you can't release inhibitory neurotransmitter, your muscles are free to keep contracting and go into spasm. This causes spastic paralysis, which can keep spreading until you get into some horrible conditions like what we call ophistotonus. It's a horrible position to be in. Think of a very weird yoga pose where this is your legs and this is your head and your hands are back like this. You're literally like a plank, a wooden plank over there like this. It's very painful and there's nothing you can do about it. And even if you look at these people, they get something where their facial muscles are paralyzed. So they get this thing called grimacing face. Grimacing face or facial grimace. Okay, so facial grimace. It's like a very weird Joker smile. So you can't stop this one. All your muscles in the face are spasmed. Then you have this sort of a agonizing smile on your face. Okay, and sometimes even this happens in babies. You get neonatal tetanus, and that's when when a baby's born and you have to cut the cord. If you use a rusty blade, or if it's contaminated, especially if you deliver somewhere outside the hospital setting. Like imagine you're in a rural environment and you cut the cord, and some dirt or dust, especially with the fecal matter of animals, like if you're in a farm, gets into that cord, then you get a person who's a baby who's completely paralyzed. Anyway, so this again inhibits the release of inhibitory neurotransmitter, and it's due to Clostridium tetani, another bacteria that is related to your Clostridium botulinum. Then you have another toxin to talk about called alpha laterotoxin. So alpha laterotoxin is a toxin that gets injected into a person when they are bitten by the black widow spider. This is commonly seen in the US, and the black widow spider toxin is alpha laterotoxin. It binds to presynaptic receptors, and this causes a massive increase in calcium influx into the cell. This causes a lot of neurotransmitter release. Remember, calcium comes in, some neurotransmitter goes out, and this causes spasm of muscles, and again you get spastic paralysis, and a fair number of people die in the US every year because of this. Then you have the non-depolarizing blockers of the neuromuscular junction. So, when you do anesthesia or in certain medical procedures, we want to keep the muscles paralyzed. So we have different classes of blockers for the neuromuscular junction, or things to paralyze the muscle. And one of them is D-tubules. D-tubules, C-U-R-A-I-R-I-E. So this is a medicine, a drug which you obtain from the bark of one of these venomous plants, which you can even find in the Americas, South America. So what happens is you get this sort of muscle relaxant, and how it works is when you give it to the person, the D-tubules is going to bind to your nicotinic NM receptors over there. So you get the NM receptors here. D-tubules is going to bind to them, and it's not going to allow acetylcholine to bind to it, because these places are all hijacked by D-tubules molecules. So the acetylcholine is now unable to bind. There is a sort of competition that's taking place between the D-tubules and the acetylcholine. And if you have more acetylcholine molecules released, eventually they will be able to knock out the D-tubules from these receptors and resume contraction of the muscle. So there is a competition that is taking place between these different molecules, between acetylcholine and D-tubules over here. And people used to use this for hunting. The Native American people, the Native American Indians, used to actually use poison arrows and poison darts with compounds of D-tubules, which they obtained from plant matter in the jungles over there. So they used to just paralyze an animal, just hit it with a dart, and the animal runs a little bit out of shock, and eventually it gets paralyzed, and then they can eat that animal or whatever. There's another toxin in nature called alpha bungaru toxin, and this is from the crate snake. So this is a kind of snake which you can find even in India and in Southeast Asia, and it releases this neurotransmitter that causes again blocking of the nicotinic receptors. So acetylcholine is not able to bind to it, and it's going to again cause paralysis. It works the same way like your this one, D-tubules. Then we have another class of drugs called depolarizing neuromuscular blockers, and succinylcholine is the classic thing. Now look, depolarizing meaning it binds to the receptor, and it actually activates the receptor. It activates the receptor, activates NM receptors, but the thing is it overactivates. It does too much of activation. When you overactivate the receptor, then that receptor stops working in some time. It actually undergoes some thing called downregulation of the receptor. So whenever you overstimulate a receptor in nature, what happens is eventually it stops working so well. It's like it's being overwhelmed by the stimulus. So maybe the cell starts reducing the number or the functionality of the receptors present over there. So this causes paralysis of the muscle. This is especially used in operations involving the stomach. So when you do gut surgery, stomach surgery, or even people who do in the lower limb surgeries. You want to keep those muscles paralyzed, so you can use succinylcholine. Be aware that sometimes succinylcholine, it's destroyed by pseudocholinesterase. Pseudocholinesterase. This is another enzyme which is present in your synapse. Like you have acetylcholinesterase, you have an enzyme called pseudocholinesterase also. And what happens is this one, succinylcholine, is destroyed by pseudocholinesterase. But some people have a genetic mutation where they don't have pseudocholinesterase. They only have acetylcholinesterase, which helps them with their normal physiological activities over there of neuromuscular transmission. However, if you don't have pseudocholinesterase and you inject a succinylcholine, these people will stay paralyzed for a while. The succinylcholine will not be destroyed. It will stay in the system, in the body for a longer time, and this can actually mess with recovery from getting back your functionality. It will take time, and that for the succinylcholine to leave your system. So these people will need ventilator support sometimes. You need to keep that ready in case you are using succinylcholine. This does happen. Just be aware of that.